call the Member for South Coast and Speaker of the House.
Thank you, Mr Acting Speaker. Last week I was very pleased to join with my colleague, the Member for Kiama, Gareth Ward, to announce the Berejiklian Government was investing $250,000 at Shoalhaven District Memorial Hospital. Specifically, I was very pleased because this funding will be utilised to enhance facilities in the integrated paediatric unit, which include the children's ward and special care nursery. Specifically, the funding will be used to enhance the existing playroom and outdoor area, make the special care nursery a supportive environment for parents and newborns, and improve parents' access to facilities in the integrated paediatric unit. This is a fantastic investment into our local hospital, one that's been welcomed by hospital staff, doctors, nurses and patients. In fact, hospital staff campaigned for this upgrade, which I, along with the Member for Kiama, was very pleased to deliver last week. Head of Paediatrics, Dr Mark D'Souza, has noted that clinical care is the important part of the hospital, but this money will reduce the impact of what can otherwise be a harsh and cold environment. I thank the hard-working staff, doctors and nurses at Shoalhaven Hospital who do an amazing job day in and day out to ensure they provide the best possible care to all patients. And that's why it was so disappointing to see comments from the Labor Party candidate and Labor Party generally labelling this investment as pork barrelling, a complete slap in the face to hospital staff who themselves proposed and campaigned for these upgrades. Clearly, the Labor candidate for South Coast doesn't understand models of care for young patients. This is no surprise, especially given the previous and only visit by the Shadow Minister for Health to the hospital and duty Labor member for South Coast, which saw them stand out the front of the hospital, posing for the media and failing to go into the hospital to meet any of the hard-working doctors or nurses or hospital staff. Another Labor stunt. All patients require the best possible physical environment to aid their treatment and improve their healing times. Doctors, nurses and hospital staff know that providing a physical environment that makes a hospital ward less like a hospital improves patients' morale and well-being. So Labor's response to this investment is nothing more than political, unwelcome and totally offensive. The simple fact is that any investment in our local hospital should be welcomed, no matter how big or small. And the truth is we've seen record investment at Shoalhaven Hospital over the last 8 years, money that we've never seen delivered to this hospital before. The annual initial expense budget at the hospital has increased this financial year by over $16 million. Last year, $12 million increase on the annual budget. As well as constant increases to operational spend, the New South Wales Government has invested significantly in hospital infrastructure to provide additional services, improve facilities and essential upgrades to improve patient care. This includes a new multi-deck car park with I think more than 220 spaces, reaffirming the New South Wales Government's commitment to providing access to state-of-the-art health facilities in the Shoalhaven region. In addition to the 5 split-level car park to be built on the health campus, an additional 60 ground-level car spaces will also be delivered. On top of this, $50 million has been invested in the hospital over recent years, including the reconfiguration and expansion of the emergency department, the addition of a dedicated endoscopy unit, refurbishment of Medical Ward B to provide a purpose-designed aged care unit, and construction of the Shoalhaven Cancer Care Centre and subacute mental health unit. The 2018-19 state budget also included $15 million to progress planning for a number of projects, including the Shoalhaven District Memorial Hospital upgrade. This will support the detailed planning required to consider the future requirements for the Shoalhaven community and what investment may be required at Shoalhaven Hospital in the future. The master planning exercise is an essential part of informing how best to respond to the health service needs of the Shoalhaven community. On top of this, we're providing additional staff at the hospital. This year alone, the Illawarra Shoalhaven Local Health District welcomed 65 medical graduates as part of a record intake of intern doctors funded by the New South Wales Government. In addition to the 65 graduates, 132 medical graduates under the new Rural Preferential Recruitment Pathway will spend the majority of their first 2 years working in a rural setting. 20 graduate nurses and 2 student midwives also launched their careers at our local hospitals this year. In addition to the nurse and medical graduates, the New South Wales Government has funded the Illawarra Shoalhaven Local Health District to enhance their special palliative care service through the appointment of a second staff specialist. The Berejiklian Government is getting on with the job of delivering improvement to our local hospitals, whether that's improved infrastructure or additional staff. hospital staff, and I will not be lectured to by the Labor Party or the Labor candidate who have rejected reasonable and appropriate improvements to our paediatric unit. Labelling these enhancements as pork barrel is simple stupidity. You should be welcoming any enhancement of your hospital as a Labor candidate or Liberal candidate or any candidate. And I will continue, along with the member for Kiama, to work with our community to deliver the services that our community needs. Labor Party and the Labor candidate should be ashamed of themselves.
Mr Speaker.
Parliamentary Secretary in reply.
Mr Speaker, I'd like to thank the member for South Coast for her brilliant, beautiful and eloquent address, campaigning hard for health services but also additional staff resources that matter to our community. And I have enjoyed working with her and witnessing her strong leadership in our community across not just these health services but improvements to dental services, and her hard work for hospitals all over her electorate. Her electorate is incredibly lucky to have her because she understands that public health and a strong public health system is vital for our community. Like her, I was inundated with complaints about the comments made by the South Coast Labor candidate, by doctors and nurses who were offended at her ignorance and stupidity. And to say that investments in the children's ward were not warranted were absolutely disgraceful. And I'm sure that those doctors and nurses will make sure their displeasure is known directly to her. As a former union official, she should hang her head in shame.
Speaker.
Call the member for Holsworth.